virus. But let's begin with the shortage of tests and medical supplies, including protective masks, as hospitals scramble to find the equipment they need to treat patients and ward off infection themselves. Joining me now is the administrator of the Federal Emergency Management Agency, or FEMA, Peter Gaynor. Administrator Gaynor, thanks so much for joining us. I'm going to start off by looking for clarity on a pressing issue facing healthcare workers across the country. How many masks does the federal government have right now, and when can they get to local hospitals?
Well, when it comes to supplies, we have been shipping from the national stockpile for weeks. The demand on these critical items is not only nationally, it's globally. So we've been shipping. We shipped today. We're going to ship tomorrow. We're linking supplies not only from the national stockpile, but from vendors and commercial donations. And it's just not about the federal government buying it. It's also about those hospitals and other facilities, governors, that if you find it on the market, go ahead and buy it. FEMA will reimburse you for it. So this is a shared responsibility. Every American has a role to play in defeating the coronavirus.
Do you have any specific numbers on how many masks the federal government has been able to acquire and how many have gone out the door to hospitals?
It is a dynamic and fluid operation. The president appointed FEMA 5 days ago to manage federal operations. And since I've been here, we've been shipping continuously from federal warehouses, and again, connecting those governors that need supplies to those who have it in the commercial sector.
Do you have even a rough number?
I can't give you a rough number. I can tell you that it's happening every day. And my mission is operational coordination of all of these things, and that's my focus. So whether it's supplies, vents, you name it, we are finding it, identifying it, and shipping it to those who have requested it.
You understand, though, of course, that the inability of the federal government to give a number in terms of masks alarms people. It makes people concerned that there aren't masks going out the door. I'm not saying that that's the case, but without a number, it doesn't fill people with confidence.
Yeah, I'm not sure it's about an exact number. It really is. I think every American has a role to play. And so let me just give you an example. When it comes to testing, and Dr. Fauci said it yesterday, the president said it yesterday, if you don't need a test, if you don't have symptoms, please don't get a test. For every test that we do that someone doesn't have symptoms for, that's PPE not used well. So I ask every American, if you have symptoms, go get a test. If you don't need a test because you don't have symptoms, don't do it. That helps us. It helps governors. It helps your local community. Please play your part in this effort to defeat the coronavirus.
You just made a reference to PPE. That's personal protective equipment. It's what healthcare workers and first responders need to wear. And this brings me to my next question, because it's not just masks that we're talking about, that there are shortages on the front lines, as you know. It's swabs, it's tests, it's ventilators. Obviously, it's FEMA's job to coordinate all these requests coming from all over the country. I want you to take a listen to just 3 governors in the last few days.
All of Nevada's requests to the federal government regarding drive-through swab testing pods, swab test kits, and testing reagent kits are on an indefinite backlog.
Do you have the masks, the ventilators, anything you need to fight this virus?
No, we don't.
Do we have enough beds? Do we have enough gloves? Do we have enough PPE equipment? And the answer is no.
For the governors of Nevada, Michigan, and I'm sure you recognize Governor Cuomo of New York, you said yesterday you've been getting requests for masks, swabs, ventilators, and more. When should local hospitals expect to receive these supplies?
So it's all about priorities. We have been focused on the hot spots, New York City, Washington State, California, and others, to make sure that we send these critical items, and we understand they're critical, to get them into the hands of governors and medical professionals so they can treat those patients affected by the coronavirus. This is our mission. I have 20,000 FEMA employees, and I have all the employees of 13 federal agencies, the private sector, here devoting every single minute of every day to meet this demand.
Can you tell us how many tests, masks, ventilators are in the demand? How many the governors have requested from you in terms of those items?
I can't give you the micro. I can say that there's hundreds of requests from virtually every state in the union looking for the same exact things. And it's just not the demand nationally, it's the demand globally for all these items. And again, we're trying to make sure that we focus our efforts to those hotspots that need it the most. And then if you don't need it right away, then you're going to be a little bit farther down the list. But we'll get to you.
Again, nobody's doubting the sincerity of your effort, but the lack of numbers is alarming because it makes people think that maybe we don't even have a full understanding of the problem. Let me ask you, the president suggested on Saturday that even though he invoked the Defense Production Act for the coronavirus response that would allow the military to supply more, and even for the president to compel businesses to manufacture some of these well-needed supplies, even though the president's invoked it, he's not actually ordered any companies to manufacture masks, ventilators, et cetera. Has the president, as of now, Sunday morning, ordered any companies to make more of any of these critical supplies?
No, and we haven't yet. It really is leverage, I think, to demonstrate that we can use it, the president can use it anytime. And it's really amazing that how great America is. All these companies are coming up asking us what they can do to help. And we haven't had to use it because companies around the country, donations, they're saying, what can we do to help you? And it's happening without using that lever. If it comes to a point we have to pull the lever, we will. But right now, it is really it's really a great sign about the greatness of this country.
Hospital systems in the U.S. are already starting to become overwhelmed. It's going to get much worse in the coming weeks. A Kaiser study out this week found that a majority of counties in the U.S., a majority of the more than 3,000 counties, have zero ICU beds, intensive care unit beds. And in counties that do have them, there's only one bed for every 1,300 individuals over 60 years old. Should the Army Corps of Engineers and FEMA be right now constructing hospital tents all over the country to prepare for this influx?
Well, we're already doing it. Well, we did it in D.C. We're about to do it in a couple of states. And again, I think 90% of the new cases are from New York State, and half of all the cases are from 10 counties around the country. So that really is our main effort, to kind of get in there and blunt it. And then we're going to look to where we need to move next. Again, these are our priority states.